Hello everyone, I am Dr. Richa from Physiology Open. In today's video, we will talk about what are the things to focus in practical exam. So you might have been giving practical exam in your internal assessments, and when we talk about university exam, it is exactly of the same pattern, though it includes all the various types of practicals which you have conducted. That means there will be a section on hematology practical, there will be a section on clinical examination, human examination, and also for your spotters or OSPE. Okay, so when we are doing a particular practical, remember that the viva and doing are two different things. In fact, in exams we have separate marks for technique, how you have done the practical, and separate marks for viva on the practical. So you should very well know what are the steps of doing the practical. You should be able to perform the practical. So skill is important, and viva definitely has separate marks. So but remember that if you do not know the practical, or on that particular day you do not perform that practical very well, but still don't worry, because if you give your viva properly, still there are chances that you will get good marks. Okay, so one is technique, skill, and then viva. When you are performing, pay attention to the precautions, pay attention to little minor things apart from the skill as well, like you keep your table clean. When you are writing the observation, they should be clean observations. Don't just cut here and there, it gives a very wrong impression. Okay, so whatever is the way of writing the observation, neatly you write that observations on your notebook. Okay, so there is subdivision of marks for everything. Okay, then also you see that there is subdivision of marks for various practicals as well. So hematology has different marks, clinical has different marks, then human experiments have different marks. So even if you do not perform well in one particular section, again don't worry, you have a scope to perform in other practical areas which you might be knowing, you might be good at. Okay, then prepare your OSPEs and spotters very well, because it is short marks. It is like maths. If you have performed them well, you will get full marks. Okay, so it is very important that whatever charts are shown in your college, because generally we get charts which are shown in our college. So you might be having the bank in your colleges. Prepare them well, and they will ensure short marks for you in practical. Okay, then there is a skill OSPE, that is observed station. I don't know all colleges are having or not, but in some colleges we have this skilled OSPE where you perform certain skill. Say suppose for hematology you will be asked to make a peripheral smear. For clinical examination you will be asked to maybe look for pallor or look for cyanosis, and marks are given for each step. Okay, so that is a skilled OSPE. Again, you have the scope of getting full marks in this as well if you perform very well. But remember, I just want you to give a tip that if you fumble in one particular step, move ahead. Okay, because it is time limited and you have to complete that skill in a particular time, and that particular step may be having very small component of the marks. Whole steps, all the steps are important, so you move ahead and perform your skill completely and report the results as well. Okay, then when you are preparing for practicals, always study with a partner. Okay, you should have a learning partner, and you study for your practicals with that learning partner. It is very important, because what happens in practical, it is important that you are speaking out. Question is asked and you speak out the correct answer, and literally fast. You don't have thinking time as you have in theory exam. So when you study with partner and practice this, say suppose if you are studying for hemoglobin estimation, then let your partner ask certain questions and you answer those questions. So same thing will repeat in your exam, and you know that you have already done a kind of rehearsal beforehand, and you will have built some confidence as well. Second thing in confidence building is, because you are studying with a partner, there is kind of a validation. Okay, the path which you are going, the way you are reading is correct, because we have some other person also who is reading that way only. Okay, so it provides you confidence, gives validation of the points you are saying, of the way you are reading. Okay, so for practical examination, it is very important that you study with partner and practice your answering skills for a particular question, because sometimes we may know the answer but we are not able to tell the answer. But what the examiner will get with that point, that you don't know the answer. Okay, so it's very important you practice your communication skills. And one day before exam, you should ask the previous batch that what are the questions the examiner is asking. Yes, if your exam is on day one, it is not possible because you don't have any chance, and but you can always help your friends that what kind of questions they are asking, what are their major areas, because every examiner has some favorite questions. Yes, they do. They should not be biased and they should ask questions from a vast area, but we are also human beings and we do have some favorite questions. So if these questions you ask from the previous batch who have attempted the examiner, it may help you. Okay, so that was about practical questions. If you have any questions related to practical exam, do message me in the comment section and I will answer that question for you. Thanks for watching the video. If you liked it, do press the like button, share the video with others, and don't forget to subscribe to the channel Physiology Open. Thank you.